Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by T.C. Webster. T.C., we appreciate you coming out. After the invocation, please remain standing for our pledges.
Eternal and everlasting Father, we come to you in the name of the Father, Son, and the Holy Spirit, praying in behalf of the members of this court, praying that their decisions that are advocated by you are done with wisdom and knowledge. And Lord, we thank you for the decision that already have been made, Lord, knowing that we have economic stability, and we pray for continued stability and financial humanitarian decisions that will be delegated by each and every member of this court. In Jesus' name we ask it all. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thanks, T.C.
Thank you.
TC, that's the quietest I've ever heard you speak.
Low-key TC.
Mr. Manius, agenda announcements.
Thank you, Your Honor. Members of the Court, we have only one announcement today. That is under Human Resources. It will be item 7F5, which is for the out-of-class pay extension for facilities management. We're going to ask that we hold any action on that at this time. Thank you, Your Honor.
Thank you. Court members, you have before you the minutes of our regular meeting of January the 22nd.
Move approval.
Second.
We have a motion and a second. Please vote. Motion passes unanimously. Thank you. You have before you the consent agenda.
Move approval of the consent agenda.
Second.
We have a motion and a second to approve the consent agenda. Please vote. Motion passes unanimously. Mr. Manius? Nope. Ms. Tidwell?
Well, that's a first.
This morning we're asking the Commissioners Court to, I'll move, ask that you approve items 7B, 1 and 2, which is receive and file the Tarrant County financial statements for the months of October and November of 2012.
So moved. Second.
We have a motion and a second to approve items
Receive and file.
to receive and file items 7B, 1 and 2. Any discussion? Please vote. Motion passes unanimously. Anything now? Ms. Glenn?
Move to receive and file the personnel agenda.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Motion passes unanimously.
Thank you and good morning. We have 4 additional items for the court. The second item, we're asking the court to approve a waiver of terminal benefits for the district clerk's office. The district clerk has an associate district clerk 3 who's retiring, or actually retired at the end of last year with 320 vacation hours. The district clerk is requesting a waiver of 152 of those hours. There's a cost savings estimated at about $4,500.
Move approval.
Second.
We have a motion and a second. Is there any discussion? Please vote. Motion passes unanimously.
Item number 3, it's another waiver of terminal benefits for the medical examiner's office. Forensic death investigator retired at the end of, or will retire at the end of this month with 400 vacation hours. If the waiver is granted February 1st, we're looking at a cost to the general fund of about $9,400.
Move approval.
Second. We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
The fourth item is actually a waiver, a request for a waiver of paternal benefits, as well as a request to double fill a position in purchasing. A senior buyer is going to retire at the end of February with 400 vacation hours. We're estimating a net cost to the general fund of approximately $4,300. The waiver, again, if granted, will be effective March 3rd. The second part of the request is the double fill effective February 19th.
And what's the purpose of double filling the
The
position?
double fill is being requested for the period, I believe, effective the 19th through the last part of the month in February, and it's just to give the incumbent, who is an external applicant, an opportunity to work with the incumbent, Mr. Voss, who's going to be leaving at the end of February. So just so this individual has an opportunity to work with the existing incumbent.
So the replacement has already been chosen.
Yes.
Move approval.
Second. We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Our sixth and final item, we're asking the court to approve additional regional e-passes for 2013. We're pretty excited. We received approval from the court to purchase 40 of these regional e-passes. We've sold all of them. So we're asking for approval to purchase an additional 55. These passes are subsidized by the county. So if approved, the impact to the county will be a little bit more than $3,500.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Mr. Wetzel.
Good morning.
Good morning.
I just have one item for the court's consideration today. I respectfully request approval of training funds to be used for quality assurance testing training for 40 staff members taken cross-functionally from the department. And this is part of our effort to improve process through standardization and alignment with best practices.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Mr. Skinner.
Good morning.
Good morning.
We have two items for your consideration. Both are agreements with the City of North Richland Hills. The first pertains to improvements to the intersection of Davis Boulevard and Mid-Cities. This project is included in the 2006 Transportation Bond Program and will be supplemented with Precinct 3 discretionary funds.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
The second pertains to improvements to Smithfield Road. It's a realignment of Smithfield Road to connect with Davis Boulevard, and this project will be funded solely with Precinct 3 discretionary funds.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Appointments.
I have some reappointments to the Historical Commission. Thomas, I'm not sure if that's Widerholt or Wiederholt, Art Weinman, Steve Myers, Wallace Hutchinson, and William Brewer. These are all reappointments.
Second.
Well, I think we also have a couple of at-large, Clara Rundell and Betty Porter. If you don't mind, I'll tag along to that.
That's
I have some too.
Okay, go ahead.
We all do.
Yeah, I have Irwin Hall, Betty Fuller, Susan Taylor. Reappointments.
Reappointment for me would be Dorothy Rencarel, Lynn Healy, and Juanita Gonzalez
Okay, so a bunch.
for the Historical Commission.
Did you have any?
I've already
I think
done
you
my
did it
appointment.
maybe a couple of weeks ago. Any other? Please.
Yes, but on a
Okay,
separate matter.
Please vote. Motion passes unanimously.
And to the Viridian TERS District, I would appoint Kathy Young.
I'll second. We have a motion, a second. Please vote. Motion passes unanimously.
That's in place of Crystal James.
Okay. And then for NTTA Board, you have before you the claims, including the addendum.
Move for the approval of the claims and the addendum.
Second.
We have a motion, a second, to approve the claims, including the addendum. Please vote. Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. Members of the Court, we have 3 items to bring to you this morning. The first concerns the Working on Wellness program. Ms. Worthy is here to address the Court at this time.
Good morning.
Good morning.
So, our Working on Wellness program is the WOW program, and it's our incentive program that we have. We have been doing health risk assessments since 2007 with that program, and based on that program, you do a pre-HRA assessment, which includes both a questionnaire and biometric measurements and incentives. So, they also get a $50 incentive to complete the health risk assessment. Each employee does. This past year, or since 2007, we've had a 45% increase in the participation. It's still not where we want it to be. This year we had 1,225 participants, which is only 33% of our eligible employee population. So obviously we'd like to increase that significantly. And I want to talk a little bit about the results of those health risk assessments. 75% of the participants were female. 27% of our employees were not in the ideal range for HDL. 18% were greater than the ideal range for cholesterol. 6% were at high risk for LDL. Our glucose had 6% at high risk. Our triglycerides, easy for me to say, were 5% with high risk. We had blood pressure of approximately 20% that were considered hypertensive, and our body mass index indicate that we had 32% of individuals were overweight, 34% were obese, and 10% were morbidly obese. So obviously we have room for improvement. And we need some ways to encourage more people to participate in health risk assessments. Screenings allow employees to know their numbers, to know their risk, the risks that are assigned with their health, and thus address those risks, whether they're doing it through a health risk assessment at the county or having an annual physical with a physician. And so many of our health risks are lifestyle related. And so we believe if people knew what their risks were and would address those in their lifestyle, that those numbers could be improved for the county. And obviously we are very interested in our employees' health, and we want our employees to be healthy and wealthy and wise, so to speak. So one of the things that we would like the court to possibly consider as we continue to move forward with our revisions of our wellness program is to incent employees to either participate in a health risk assessment or an annual physical on an annual basis, obviously. If we did that, we would probably remove that 50% incentive. And there's a variety of ways that we can incent our employees to either participate in the health risk assessment or the annual physical. One of the ways is those employees who participate could receive a reduction to their medical premium for their health insurance, okay? Or if those individuals are opt-outs, we might increase the amount of money we give them in their opt-out account. So that would be one option, is to tie it more closely to our benefits program and address that with our medical premiums. The second way we might consider incenting employees is to actually increase that incentive cash amount that we give them. As I said before, we currently give them a $50 incentive to participate in the health risk assessment. We might consider making that a much larger and more significant incentive for them to participate in the health risk assessment or to have an annual physical, something that would get their attention and possibly get more folks interested in the program. And option 3 is for those employees that did not participate, kind of the other entry into this situation, is that we would withhold their $240 flexible spending money that the county gives each employee. Of course, they could continue to contribute their own money, but we might withhold that amount if they do not participate in the health risk assessment or an annual physical. As you know, this is just a briefing, so this is for you to begin to think about and to give us some feedback, and we'll be back probably next week or the week after to get fuller feedback from you. But as we move forward, if we in fact move forward with this incentive program, we have a couple of options on how we're going to actually implement it, because as you know, the devil's always in the details of how this is implemented. We do have a vendor currently that does our health risk assessments for us. One of the options is we could contact them and work with purchasing and see if we could expand that contract in a manner that they would be able to handle a larger volume of the health risk assessments, because obviously right now we offer them only over a 2-week period of time, and if we anticipated with the number getting much larger, we would possibly have to expand that over more weeks and more locations even possibly. And then the other way, in addition to that, on option 1, is we would have to consider a way of how to gather the information from those employees that have had an annual physical in a HIPAA-compliant method. Okay? So in option 2, if the current vendor is not an option, we would have to consider preparing an RFP, going out and selecting a new vendor that could handle that and that process of both running the HRA and collecting the data for the annual physicals. The third option is, again, to continue to use our current vendor, expand the number of events held, and again, work in ways to collect that data for annual physicals. We would prefer that HR not be involved in the collection of the data process at all, that we have a third-party administrator. Recommendations and best practices in the field are that the employer not have access to that information and that a third-party administrator handles that information. And finally, of course, is the one where we would continue to, again, to work with our current vendor and then try to work with our medical plan vendor, who is United Healthcare, to see if they would have a methodology to provide us reports on employees that had an annual physical. Now, that would only address employees that are insured with the county. So if we continue to want to offer this program to the opt-outs, the incentive program, we would have to also have a way to collect the data from them. So having said all that, the PEBC, the Public Employees Benefit Cooperative that we belong to, is having discussions with their consultant and possibly going to provide us with a wellness program for 2014. We have not seen that yet. We don't know what it'll look like or whether it will even be rolled out at all. So as that information comes in, we'll have to take that into consideration as we move forward with our considerations for our own wellness program for 2014 and how we want to, on what methodology we choose and what incentive we choose. And so we look forward to your feedback, and I'll be happy to try to answer any questions I can.
As it pertains to the whole benefit package that we offer here at Tarrant County. We had several people that participated in that meeting, and we are hopeful that that's the beginning of a process that will conclude. I believe that hopefully we're going to have recommendations by March, first part of April, on how we're going to proceed forward with our benefits and our benefit packages as we go forward next year. So I think there's going to be a lot of going on in this first quarter, and I would encourage you to stay tuned. And if you want to have folks involved from your staff, you may want to communicate either through Robin or through GK as far as making sure that you have somebody at the, and that goes with all of the department heads or with all of the elected officials. Education, communication is going to be the key to it. There are a lot of things changing as a result of the implementation of the new Health Care Act. A lot of that begins in 2014, and so we're going to have to begin, making some changes that will affect that.
Judge, I would like to comment. It is certainly a good thing to encourage a healthier workforce. That's one of the reasons that we have the Tarrant County Obesity Policy Council, to encourage employers, both government types and private sector types, who all participate on this council, to look at their policies and to remove policy barriers towards a healthier workforce. One of the things that we found through those meetings is a couple of the private sector organizations go further than this annual health risk assessment and annual physical. If you just take the assessment in order to collect the $50, then you really haven't done anything. So this particular firm has all sorts of workout facilities, as do we, and they contract with a private entity to do physical fitness and wellness type programs through the existing facilities. And by doing that, they have significantly lowered their health care costs such that the hiring of the outside firm is more than paid for by the cost savings achieved in health care costs. I would like to see us implement something along those lines that closes the loop between just getting the assessment and the physical and actually having the opportunity to do something about it.
Some of those things we're talking about. You will remember last year we talked about not only the carrot or the stick type of an approach on some of the says, if we were to move to that or move to a high deductible type plan or how we move that. And Dallas County right now has an employee clinic. Well, under the new law, there's some question as to whether you can have an employee clinic and have a high deductible plan. And so there's a lot of those kind of answers or questions that we don't have the answers to yet because the regulations have not been written and we don't know where we're going to be. So it is all those things are things we're looking at, whether it be do we penalize somebody or do we say, okay, you're out of what you just outlined or the employee clinic type things. And all those have impacts on what kind of plan we may be able to have. The one thing we know is that beginning in 2014, you're not going to be able to put as much away into these health employee savings accounts as what you've been able to put away in the past. And after you reach your deductible type things, I believe. Now, it's going to be extremely complicated, but I can just say that beginning next year, what we've known as our flex accounts are probably going to have changed. If nothing else, they're going to. Now, we don't know what those changes, a lot of those changes are going to be because we still don't have regulations or clarity from Congress on that.
But we don't need those specific regulations in order to encourage physical activity.
Service, workout service, training service. If we're providing any of that, that may preclude us from being able to have a specific type of plan. That's what our consultants have told us last week, and they still don't know because we still don't have the regs out on it.
Okay.
In following up what Commissioner Brooks said, I actually called that individual that is running that particular program, high risk. Absolutely. And so they talked about, in their opinion, for the program to be really, truly effective, to build some requirements in the middle that are some physical things for them to get those incentives. So if that would be a richer incentive program than what we're proposing here. I'm not saying that it wouldn't be an excellent idea. I was kind of trying to take baby steps, but she when I did speak to her, she said, if you have the annual physical and then have some things in the middle of the year that are required also, then they would get that incentive or discount.
You might not want to make them required. but make them available and encouraged.
Correct. And of course, we have those, you know, we do have, we encourage people to participate in a variety of
Robin, you mentioned that we have about 33% of eligible employees participating in the wellness program, right? And you also talk about incentive, right? My question for you is incentive alone enough to encourage employees to participate? Can you talk a little bit in terms of support that you have been getting from department heads, especially larger departments?
Well, different threshold of what begins to incent them, whether it's a dollar amount that you get above and now they're interested, as opposed to some sort of an award, or, you know, different people are incentivized by different levels. And with regard to the participation of the departments, I think there's some mixture. We have some departments that are very strong advocates of our wellness program and supportive and encourage their employees to participate. And I think we have some departments that are barriers to that.
What about the larger?
Some of both in the larger departments. Certainly there are some of the larger departments that aren't.
This program is not going to go anywhere.
Right.
That's the bottom line.
And in the past, with regard to the health risk assessment events, we have had the county judge send out an email or a letter to encourage departments to let their employees participate. In most cases, a person could get into that health risk assessment in and out in about 30 minutes. Different
And make
approaches.
it fun, too. Make it fun, you know, like having a contest, a fitness contest between the county and the district clerks.
Right.
That would work, I think.
Yeah, we have actually discussed that. We have a very engaged wellness committee, and those are some things we've discussed. And also in the wellness community in general, there's something called gamification. And with the advent of so many social media and things, there are a lot of tools out there now that do make contests and fun. And
I have been kind of blinded to the wellness side of things a little bit. But I attended the last seminar put together by BEPC, and it really opened my eyes. The only way that we can control healthcare cost is through wellness. I mean, based on the facts that I have seen, I'm at fault here. I have been kind of passive at promoting the wellness program, but my perception has changed. So thank you for making that information available to me.
I've heard at several presentations that statistically this is the first.
Well, and I think it does say that wellness is certainly part of that deal, but also holding the employee responsible for the choices they make is another part of that. And if incentives don't work, then I think to some extent we're going to have to use the stick. Allow the employee who is a little bit more responsible with it not to have to pay quite as much. And that would ultimately, I think, be what will, you know, kind of bring people around maybe. If it costs them more in their pocketbook, then maybe they'll be a little bit more attentive.
Well, I believe all of the national research indicates that carrots work better than sticks, but you probably need them both in your toolbox.
Thank you. Any other questions? Thanks, Robin.
Thank you.
Members of the court, if we could go to item B, this concerns an update on the seasonal flu. Dr. Curian is here to address the court at this time.
Good morning.
Good morning, Doctor.
I just want to, although it is not possible to say, while the season is still in progress with certainty, what we can say definitively is that the markers that we use to track flu activity in our community, mainly 2 markers, have shown declines.
How many markers are there?
We track about 4. There are various markers depending upon how big your program is, but in our surveillance programs, we track 4 markers.
And you're saying 2 are on the decline?
2, all 4 quadrants of our county are still showing widespread flu-like illness activities. 2 of the markers that I was mentioning a little while ago, one of them being the flu-like illness-related doctor's visits. This has declined from 11.7% to 10.8%, from 8.4% to 9.8% in week 3. And the rates of hospitalization due to flu and flu-related complications, especially among the 65 years and older population, has also risen dramatically from week 1 to week 3. Week 1, it was regardless of the vaccination status. So we public health officials are closely monitoring this particular marker, and this is the highest that this marker.
And that's our over 65.
That's 65 is an older population.
65 and older.
Yes. Flu-related, flu-associated pediatric mortalities have also gone up. Nationwide, we have 37 deaths reported. This is 8 more than what was reported last week. Statewide, we have 7 flu-associated pediatric mortality, which is 1 more than what was reported last week. Tarrant County continues to have 1 pediatric mortality. We don't expect in a season where H3N2 is a predominant circulating flu strain. So our public health recommendations still continue to remain the same to combat flu this season. Adopt the 3-step approach, which is vaccination if you haven't been vaccinated already. There is still time to get vaccinated. Vaccination is recommended as long as the flu virus is circulating. Flu season goes all the way up to end of May. Number 2 is to continue goes. We have plenty of vaccines available in all 6 of our public health centers. Of the 1,000 additional doses that we received last week, we have close to 900 doses remaining. And these are vaccines that have been licensed to be used for everyone 6 months and older and are offered at a cost of $20 at all our public health centers. We also have plenty of vaccines available under the Vaccine for Children program that offers vaccines for children who are uninsured or children who are on Medicaid. Our public health centers are open Monday through Friday, 8 to 5. One of our public health centers is still active. The number to call is the same, 817-248-6299. Flu.gov site is still active, and the information available on the site is updated information. As always, weekly updates are available every Monday on our website, on Tarrant County Public Health website. Thank you for your time.
Let me ask you one. There's also been reported that in addition to the flu, there's a stomach virus going around. Can you speak at all to that?
It's not a new virus, but the strain, norovirus has been, it's not a new virus. It's been around for forever. But the strain that's been identified is the Australian strain, and that has been causing a lot more havoc than the regular norovirus strain. We haven't detected any of those, the new norovirus strain in Tarrant County or for that matter in the state of Texas just yet.
Okay, so we're hearing a lot about that, but even though
the court, I will do item C very quickly. This is the legislative update. Just wanted to point out 2 things in your court material. Your court material contains the Senate draws as far as terms of the senators, and 2 of our senators drew 4-year terms, and 2 of our senators drew some coverage in the media and be able to analyze whatever the governor says at that time. I'll be happy to answer any questions that you might have. Hearing none, Your Honor, that's all we have this morning.
At this time, I will recess our open meeting and proceed to closed to discuss items exempted under 551.071, 072, 074.
Judge, we have this.
Oh, wait a minute. Oh, excuse me. Thank you very much. I appreciate that. Before we recess, we have an audience participation from Mr. David Stockman. Excuse me, sir. I apologize. Come on forward. If you would, please state your name and your address for the record, and then your comments.
Thank you. My name is David Stockman. I reside at 2450 White Settlement Road in Weatherford. My business address is P.O. Box 1537, Fort Worth 76101. Thank you for the opportunity to address the court. I'm here today to address the court concerning the issue of the location for the designated location for the substitute trustee or the foreclosure sales that happen on the first Tuesday of every month. I wanted to take a second to tell you a little bit about myself. I've been in this business of conducting foreclosure sales as an appointed trustee by several banks around the nation for about 22 years now. I've seen a lot of times, good times and bad times come and go in this business, and I'd have to state for the record that it's unfortunate that this is the process that has to occur. I remember years ago we used to have the location of the designated location by the Commissioners Court was on the front courthouse, the south courthouse steps, and was, I remember it was a big issue for the public coming in and out during the sales. There's obviously a lot of people gathering around on the first Tuesday of the month when all these foreclosure sales are taking place. I'm here today to represent myself, and I have 3 assistants that work with me on the trustee sale day on the first Tuesday of the month. I work for about 25 different law firms around the state, and I'm here representing other trustees that are also conducting sales on the first Tuesday of the month. And as I'm sure the court's aware, we are required to conduct our sales in a location that is designated by the court. I'm here today, basically, I have 2 concerns I'd like to address the court about. The first concern is the weather, and the second concern is a safety issue. Concerning the weather, the designated place that you have chosen for us to conduct our sales is at the base of the east side courthouse steps there. And in years past, when the volume was not at the record levels that we've had this last year, and I expect that we'll hit record levels later this year again, it wasn't as much of an issue because the volume was so low, it didn't take that long to conduct all the sales. I can speak from personal experience that myself and my assistants, we're there from the beginning of the sale to the end. We're there from about 8:30 in the morning till about 4:30 in the afternoon, conducting our business as required by the legislature. And of course, where we're located, there's usually a couple of hundred people gathering around, looking for these sales, from various investors to homeowners or whatever people, just observing the sales to learn about it. We're obviously exposed to the sun, the wind, and the rain. And years ago, when it was just me conducting the sales, I would only, most of the sales go back to the bank, where the bank bids in a minimum amount, and it's obviously more than anybody's willing to pay, and so we sell the property to the bank. More and more now, there's more people that are buying these homes at the foreclosure sale, and so we have a lot of paperwork has to be filled out. We have money that changes hands, and to complete the process. Like I said, when it was just me, I would only do anywhere from 5 to 10 of these, what we call third-party sales per month. Very easy to conduct the paperwork. Now, current times, I'm selling just myself, not including other trustees. I'm doing probably about 80 of these third-party sales per month. One of the big reasons that this is occurring now is obviously the volume's a lot higher. But in the last 5 or 6 months, we've had several companies move in from out of state that have perfected some model of buying these homes and turning around and renting them instead of the usual investors buying them and trying to flip them for a short profit. I think this is a good thing for the marketplace and for our county, because these people, these out-of-state companies, and there are a few in-state that are doing it too, but they're buying these homes at basically approaching a retail value, which is helping all of our home values, whereas the normal foreclosures, hurt the value of the homes in the appraisal district process. But the problem being we're doing so many of them now that I've gone from just me being able to do it myself to having to have 3 or 4 assistants on sale day to be able to process all the paperwork. As the legislature's prescribed, we have to conduct all of our business and between the hours of 10 and 4 o'clock, so it's a kind of a hurry up, chase the clock kind of deal to get it all done before the window closes on us for that sale day. So being exposed to the sun and wind and the rain, myself personally, I've done it for 22 years, and I've dealt with the rain and the cold and the scorching sun, but it's difficult when you start having my assistants. So I have 3 ladies that help me, and it's hard to ask them to sit out in the sun for 8 hours and bake while this has happened, or problem we have if it's a really windy day and we're trading cashier's checks, and I can tell you that we're trading millions of dollars worth of cashier's checks on these days. Just myself, not alone the other trustees. I'm always worried about one of them getting loose and blowing out across the street and having to chase a $100,000 check across the street, get hit by a bus. And obviously, during the rain, it's difficult to process all this. At one point, I tried to locate my girls up on top of the courthouse steps there which is not really fair to anybody with a disability. I had somebody that was in a wheelchair tell me it wasn't fair that they have to figure out a way to get up the steps to exchange the money to conduct the sale. So I'm here today basically asking you for some sort of maybe if you could figure out a different place to move the sales where we have a little bit of shelter from this, or maybe allow us to provide our own shelter. Last year I had spoke with David Phillips over at the county, the courthouse maintenance supervisor, and appealed to him to see if we could set up some sort of awning to get out of the elements somewhat, and went through some process with him, which was ultimately denied. And I do understand the concerns of the county that if 50 people come out and set up awnings, it could create a zoo out there. And I don't think there would be that kind of deal. There's probably 4 or 5 of us that may want to do that. Most of the trustees only have maybe 10 sales or less. There's a few of us that conduct, quite a numerous amount of these foreclosure sales. I think it's an issue that's obviously the county must have some awareness of, because the sheriff, somebody is setting up a big awning out there for the sheriff to be able to conduct his sales, out of the weather. And, I would like to have the same privilege to do something like that myself for me and my people. The other issue that I'd like to ask you to consider is the fact that from a safety point of view, considering the number of volume we're doing and the amount of money that is changing hands, is a safety issue, just from the fact that we're talking about millions of dollars a year. Most of it's in cashier's checks, but some of it is in cash, and I would appeal to you to find some way to maybe have an officer present or something. I don't have a concealed carry permit. I've thought about getting one, but I don't know if I would be even allowed to carry that on the public property outside the courthouse. But if you would take a moment to consider the fact that we are at some risk of somebody trying to abscond with all of our money, I would appreciate some consideration.
Okay, was that?
That's all I have to say.
Because this is not on our agenda today, then we're prohibited by law from responding to your comments.
Okay.
But what I would say and ask of you is for you to get with Mr. Manius, our administrator, and I think there's some very valid points. Just come back with some response or something where we can discuss this, and if we can, if everybody can reach a good feeling about this, then we don't need to bring it back. But otherwise, we need to know what we're required by law to do and what latitudes we have to address some of the issues that Mr. Stockman has mentioned here today. And I think then we can put it on the agenda and discuss that. And he'll talk with you right now, and then we'll go from there. Thank you very much.
Thank you for the opportunity.
You bet. Thank you. Now we will recess our open meeting and proceed to close to discuss items exempted under 551.071, 072, 074, 076, and 087 of the Texas Government Code. Having returned from our closed session, there being no business to conduct at this time, we're adjourned.